Welcome, guys. As you know, today is World Population Day. So, to discuss about it with us is Dr. Sreevidya, who has recently joined as a first-year resident at KM Hospital. Welcome, Dr. Sreevidya. How are you finding community medicine at KM Hospital?
Hi, Dr. Biplab. Thank you so much for having me today. It's been quite a journey, and so far it has been a really pleasant journey, and I hope it will be better in the future.
Okay, so today we will discuss about population growth and its impact on human health. So my first question is, what are the global population trends and how is India's population growth?
Okay, first of all, I'd like to appreciate you for taking this, this topic for this discussion on this day. So, talking about the population, world population, let me show you some statistics. In 1950, the population, world population was 2.6 billion, which increased to 5 billion in 1987, which is not much of a time period, but a large increase in population. And then it got to 6 billion in 1999. And by 2011, we crossed 7 billion mark. And today we stand at a population of 7.6 billion. So I think these figures might have made it clear that why it is important to discuss population, because it's growing uncontrollably. Now it's said that if this trends continue, by 2050, which is not very far, we will have a population of 9.7 billion, and by 2100, it is said to reach a point of 11 billion, which is more than what our Earth can now sustain, is what I feel. Now, talking about the Indian context of the same population problems, we know that India is now the second most populated country in the world after China. And India contributes about 18% of population to the world. This 7.6 billion that we talked about, of which 18% of the world population resides in India. And that's about 1.4 billion as of today. Now, right now, India is in the late expanding stage of the population dynamics, which means that now Indian population is, we still have a birth rate which is higher to death rate, but our death rates are declining. So that is what late expanding stage means. And if this same trends of same trends of population growth continues in India, it's said that in 2027, which is very near, which is in 5 years, we will overtake China, which is alarming. And now, when you talk about the history of population in India, let me give you some numbers. 238 million was our population just in 1900s. 1900s, when we were all just very little and just growing up. And it was 439, which is a double of this amount in 60 years. And in just 30 years, it was again doubled, which means from 1900s, in 60 years, what double the population has happened in 30 years in next. And in 1991, which is just 30 years, is where we have a 846 million population. And now we are in a population of 1.4 billion. And if this continues, by 2050, we will have a population of 1.53 billion, which is far beyond the population of China itself. We'll be the world leader when it comes to population.
So we have finite resources on Earth, and as the population of Earth is in the population of human beings is increasing, it will definitely put pressure on us and on the resources. And also, India is the second most populous country in the world. So definitely, it is a matter of concern. My second question is, what are the reasons behind population growth or decline of a country? So, Dr. Sreevidya, what are the parameters or the things which are responsible for increase in population or decline in population of a country? I'm sure there will be some countries where the population is increasing, but there will be also some countries where the population is on decline. So what are these parameters and what are these measuring criteria which on which there is population growth or population decline?
Okay, basically the parameters that directly contribute to or influence the population are mainly the birth rates, the death rates, the migration statistics. So what happens is that when a country has a lot of births happening and a lot of and very less number of deaths happening, naturally the population will increase in that country. And also life expectancy is another thing that takes place here. So as you grow towards a developing nation or a developed nation, as developing happens in a nation, there is a general tendency to have a increased life expectancy and a decreased death rate. That is, your health advancements, and your hospitals, your all the resources are increasing, and all are channeled towards increasing the life expectancy of a human being. So this is definitely going to increase the death rate. I mean, decrease the death rate. So when this happens, we are going to reach a situation where there is, when development happens, we are going to reach a situation where there is less birth rate. And this less birth rate can be due to more education. People are not getting to know more about family planning strategies, about and also women getting employed is a major influence here. When women get more employed and they get more gender equality, they tend to the family tend to be more concise when compared to the other families. So this development results in a decrease in birth rate and a decrease in death rate. I mean, decrease in birth rate and decrease in death rate as well. So this is going to decrease the population as a whole. So in general, when you're talking a country, when there is a lot of people born into the country and a lot of people not leaving the country, that is when the death rate is low, that is called as an expanding population. That country will have more people than the other countries where there is lesser people who was born into the country and more people who are dying from it, which is a case of a underdeveloped country or a poorly performing country.
So
And also migration is another attribute here. When urbanization happens, people tend to move from a less developed region to a more developed region and look for better standards of living and look for better employment opportunities. So this is migration into or out of a region will affect its population. When there is urbanization happening in a place, people will tend to move into it and look for employment or in look for better standards of living, for better healthcare. So this will result in an increase in population. Especially we can consider the example of Mumbai. For example, Mumbai is a place which usually people tend to come in for education or for employment or for health. So there is a influx of population into Mumbai. And usually in rural areas, in underdeveloped areas, there is a tendency for people to move out of the region, resulting in decrease in population. So these are the factors that directly affect on population of a region.
okay, so factors like birth rate, death rate, migration, life expectancy. So these are the factors which affect the population growth of a country. So my
Fertility too.
okay, fertility also. So my next question is, what are the health implication of overpopulation in a country?
Okay. Overpopulation is a very serious issue that we have to tackle now. That is a growing concern especially in India. Now, overpopulation, how does that affect health? Let's see that. Usually, when there is an increased population, there is decreased employment facilities. I mean, opportunities for people. This will decrease the standard of living, and decrease in standard of living will directly affect the health. People will not be able to access health. People will have a more chance for contracting diseases. And when talking about contracting diseases, infectious disease is one thing that is going to spread a lot when there is an increase in population, especially airborne diseases like tuberculosis, for example. Tuberculosis is one classical example that we say when we talk about overpopulation. So, and the next thing is not just airborne disease. Airborne disease is the most common one that is expected to spread, but also waterborne, because water gets more contaminated as population increases. And with increase in the population, people will need natural gas, fuel, all these things when burned will release a lot of carbon monoxide emission into the atmosphere, resulting in an increase in pollution. So everything is connected. With overpopulation, we can explain concerns in all domains. So when there is a increase in pollution, that will also affect the effect of the, I mean, health of the people living there. And in general, now food is another crisis. Because of this increasing population, food is in more demand. And people with less employment and more demand for food, the quality of food is going to decrease, and more people are going to be suffering from malnutrition and even hunger deaths.
Okay, so there are a lot of health implications of overpopulation in a country. So, Dr. Sreevidya, I would like to ask. I think you have covered some part of it, but as you see, there is due to overpopulation and migration, there is also overcrowding in the city areas, like in Mumbai and Delhi and the metro cities. So, I would like to know what are the diseases which are common in these overcrowded areas.
Hmm. As I said, tuberculosis is one of the most common concern, especially in the city like Mumbai. A lot of people, healthy people, don't even show the signs of disease, being carriers and spreading the disease to more people. So, and then comes the other vector-borne diseases. So, as the population increases, we can see how people live here in Mumbai. There is a we can't even imagine how many people live in a square meter radius of this city. So it's that overfilled. So this is going to cause a lot of vector-borne diseases as well, like malaria, dengue. All these are increasing. And when it comes to rains here, because of the overpopulation, because of the increased constructions and demand for roads and stuff, there is not much water drainage systems. It is resulting in logging of water. And again, this is rainy season. We know that it is lepto is a major concern during rainy seasons. So all these diseases are, you can say that it is one way or the other related to overpopulation.
Okay, so due to overcrowding and overpopulation, there will be infectious diseases like TB or vector-borne diseases like malaria, lepto, or dengue.